Okay, great. Rob, over to you.
Okay, thanks, Tim. Good evening and welcome to the August 17th, 2021 meeting of the Needham Board of Health. I'm Rob Partridge, Board Chair. This open meeting of the Board of Health is being conducted remotely per the Governor's Executive Order of March 12, 2020 due to the COVID-19 pandemic and is being recorded. Public access is available, but public participation is not anticipated. I will introduce each board member and each participant on the meeting agenda. Please respond by saying yes when your name is called. Kathleen Brown?
Yes.
Ed Cosgrove?
Yes.
Steve Epstein?
Yes.
Christina Matthews?
Yes.
And other members, let me just change my screen here to gallery. Tara Gerch?
Yes.
Paula Rahim?
Yes.
Karen Shannon?
Yes.
Diana Costa?
Yes.
Anna Whitehead?
Yes.
Carol Reed?
Yes.
Tiffany Zeich? May not be here now.
Yeah, she will go.
And Marianne Donnell?
Yes. Yes.
Great. And Tim McDonald?
Present for the moment, and I'll be back.
Okay.
Thank you.
All right, so we'll get started. I don't think we have any minutes to review, so we'll get right on to the staff reports for July. And I think, Tara, that actually starts with environmental health.
Okay, thank you. And good evening, everyone. So yeah, Diana and I and the environmental team have been very busy this month, as you can see. So we're still keeping up with the weekly webinars with the state. So we're just going to be taking the data day by day to see what action, if anything, is necessary for this Delta variant, but we'll keep an eye on that. We've been still actively working with Terry. I can let Diana talk more about that on the online permitting system. Organic lawn care brochure in PSA, where, as you know, Allie, our new intern, is now busy working with us on updating our organic lawn care brochure that the Board of Health had done many years ago. I think, Ed, you might have been still on the board when we first initiated that pamphlet, but we're revamping it and updating it with new resource information, and our hope to get that out to the public for an educational type brochure on alternatives to pesticide use. So that's an exciting project that Allie is busy working on for us. We're also, we have a couple of restaurant trainings in the midst. I know this has been on our updates ongoing, but right now we do have an update that Masala Art, it had an initial training and they're doing a follow-up training to get the remainder of their staff. So this is good progress that we're observing with the funding that we had available to enable these restaurants to get the proper training for repeat violations that we keep seeing. So this is great. So we'll keep pushing for that. Farmhouse will be next for that food consultant training that will be coming up shortly. The other item I wanted to talk about is the RTS expansion for the organic waste collection program. So I met with Greg over at the RTS, and he's excited to try to initiate more organic waste collection from Needham residents. So we walked the site, we looked at areas where they could put the waste barrels. He's working with AgriCycle again, which is the same hauler he was working with previously. And we're also expanding the organics recycling programs at the Needham Public Schools. So as you may know, there's 4 schools that currently, they had to pause last year because of the pandemic, but they're looking to start that up again this year, pending any DESE updates or information that they get for social distancing. But right now they're going to take baby steps and try to get the other 4 schools on board with starting up their organics recycling program. So Diana and I met with Colin, the new director of food nutrition program for the public schools, and we met with Jen the school nutritionists, and they're all on board to work with us on that. So we'll be working on collecting similar protocols that we collected from the other 4 schools, where we have a signature page, like a set of protocols that we agreed to initially at the start of the program. And each of the different staff members that are in charge of the different pieces of the program, like the custodian, the principal. So it sounds like it's going to work out the same way. And Diana will go out prior to starting at the program up at the other schools to verify signage and the waste containment receptacles and things like that, so that they could start that off. We had a meeting with them yesterday, and we were like, as long as you can have a nice clean program where the waste is, the areas are power washed and there's no overflow of any organics, that's the goal. So we don't have increase in pests. And so they were all on board with that. So we're hoping that that will be a good expansion for the schools. As you could see in our highlights too, the tobacco regulation, we have a quick update. We could do that next month. Lynn has been great at working with us on making those updates, as well as the regulations, which we'll bring those up next month to finalize. I'm trying to see what else. We reposted for the environmental health agent part-time job. We got an initial round of about 6 applicants for our first posting, and we felt we need to go out to repost again. So we went out again and we're posting it for longer. So hopefully we get more applicants the second round. I think those are the main updates. I don't know if Diana, you want to continue?
Yeah, there's not too much more unless the board wanted to focus on anything more specific. The website for online permitting, like Tara had mentioned before, she's really collaborating with Terry from IT so that we're working on the well permit right now and then looking to get more stuff. And Ed, I see your hand is raised.
Yes. About the organics recycling at the I call it the dump. I'm an old resident. Where are they planning on putting that? Is that over near the current leaf collection and so on in that area?
So I think right now they're looking to put it next to that long, like, field house building in the back. They're going to kind of segregate it and have it in a safe location so that it's out of the traffic. They didn't want to mix it in with the other waste receptacles.
Right. Okay. And
Yeah,
then
I think they're going to be very specific, like AgriCycle waste receptacles, so that when AgriCycle can come pick up their stuff, it should be in a separate area.
okay, so that'll never get mixed with any of our organics or anything else.
No,
Shouldn't.
And what about accepting animal waste, not feces, but rather fat and bones and things like that? Are they going to
that's
accept that?
all included with this waste collection.
Yeah,
It is.
that's what I
Okay.
was under the impression. AgriCycle is one of the only, or at least one of the only ones that I have heard of that will take bones and meat like that you don't have to separate out the meat.
Okay. I'm just worried about rodents, that's all. So,
Makes
okay,
sense.
thank you.
Very loud and clear with Greg that he will work with us on increasing any type of rodent or pest control if needed, and he'll make sure he power washes that area routinely to keep it clean.
Mhm.
And
Yeah,
he'll
'cause I
do
was
Okay,
gonna
that.
say
good.
from experience, like seeing other composting areas, that seems to, it is an attractant, so we just have to make sure that the totes are secure and clean.
Okay, good. All right.
And then the only other update, I guess that's important, is the Kendrick. So DEP and Ramble are being very good and continuing to update us on anything that's going on. Department of Public Health from the state actually contacted me yesterday and today to let me know that people have been contacting them, so that she just wanted to make sure that we were in the loop and that they can help us answer questions as well. So if I wasn't sure how to answer, DPH can also answer questions, but we're all just trying to stay on the same page. Kathleen, I sent you the document today that DEP sent out. They made like a fact sheet for the residents, because there were residents getting specific results for their unit. And then there was other VOCs that were heightened that came up on the report. So then of course, when they see red, they get worried. So he just made that fact sheet to kind of explain what that means, that they're not necessarily in harm's way, that's just how it looks on the report, but it's definitely better so that they have the background of what's actually going on. And I think I gave this update last month, but I just want to make sure that you guys know that Charles River Landing was tested and they did not see any spikes in TCE or anything like that. So we should be good. So fairly confident that whatever is happening was just restricted to the Kendrick building and it's not around. I think that's it. Unless there's anything else, we can move to the next one.
Any other questions from the board members? Okay, so if we're done with the environmental health, then next would be traveling meals. Marianne?
Hi. No updates. We're running along smoothly. Everything's working and people are being fed. Any questions? Okay, that's it.
No, great.
Okay, thank
Carry
you.
on with a great program.
It's needy. Yes, thank you.
All right. I don't think Lynn is here. Yeah, I don't see Lynn here. So next would be substance use prevention. Karen?
Hi, good evening. The month of July was a pretty steady one in terms of what we had on our plates. A couple of the highlights I'll just mention briefly. I'm pleased to say that we filled 2 part-time openings for our prevention team, one of which will be working with me directly on the SPAN, Substance Prevention Alliance of Needham Coalition work. That is Angela McDonald. She actually has been working with us for our vaping grant administration, and she's now moving over to assist us directly with SPAN. So we're excited to have her in that capacity. And then the second position is to fill a part-time position for our new STOP Act grant from SAMHSA, which just began recently. And we have Jasmine Hurley, who has just started this week and will be ramping up to help us with the administration of that grant. So we're quite pleased about that as well. On a slightly different front, Carol, Reed and I worked together to bring a meeting together between the Needham Public School Administration and Dr. Randy Schuster, who's a clinical psychologist at Mass General Hospital for their Center for Addiction Medicine. We brought the principals of both the high school and the middle school, as well as the director of guidance for K through 12, Tom Denton, to this meeting to have them learn about a program that Dr. Schuster has been administering in the Boston metropolitan area for the last 7 years to various school systems. And the programs involve the administration of an online survey to help assess student mental health and substance use indicators, and are a way for Dr. Schuster to identify certain students who may be good candidates for some of their resource and access to treatment resources. So we were delighted to have that opportunity. The school department has in fact decided to go ahead and sign on a commitment to those programs. I could elaborate more on the details of the programs, but suffice it to say that these are resources that will be free and confidential to the students. They'll be brought directly to the school campus versus requiring students to access them downtown in Boston at Mass General Hospital. And we are really excited to be able to offer this resource to our Needham youth community. So we're very happy about that. And we will stay tuned as that launches into the school system, hopefully this coming year. That's the plan. And then lastly, just a quick note, we have 2 SALSA students from Needham High School who have been interning with us as volunteers this summer to help us develop social media content for a number of different prevention campaigns. The idea being that we will be stockpiling the content that they create, so we'll have them at the ready as we go about the remainder of this year and into next year for various prevention initiatives, both on the local level and more nationally. So we're delighted, and I tell you, never ceases to amaze me how smart and adept these young people are creating social media content. So we're really lucky to have them. And I would say that's about it for our updates for the month of July.
I just had a question about the programs that you were talking about through MGH.
Yes.
So there's two different programs. One is the for mental health one, and the other one is I Decide.
Well, they are two different programs. The Project Arches is the one that involves an online survey to help identify students who may be at risk for severe mental health indicators or potentially substance use concerns. And those indicators then make the student eligible, if they wish, to participate in a couple of different opportunities through Dr. Schuster's research programs to connect them with different services, whether it's a marijuana cessation program, a vaping cessation program, and then there's a mental health resiliency program as well. The other program is called I Decide, and it's a brand new program that they're offering in Diversion. So it's intended to model best practices around youth diversion for students who are perhaps identified as having violated the chemical health policy, and it helps the school administer a less punitive approach to really get at the underlying causes for that student's substance use and how they can best support them, again, through a non-punitive and more educational and therapeutic approach to their substance use.
And has that program, I'm very curious about it. Has it been tried
Yes.
in other communities, or is it part of her, just part like a research project currently, or?
So the I Decide program, Carol, correct me if I am wrong, is a very new program and one that's being rolled out just now, starting this year. The Project Arches program is one that's been around for, I believe, 6 to 7 years, and she has had that up and running, I think, to 11 different school districts in the Boston metropolitan area.
And do you know if it is research or?
It is. Dr. Schuster is really able to deliver these programs as a result of the research that she's been conducting for a number of years at Mass General. And she's been fortunate to receive funding that will now basically, has been able to offer her already and will continue to offer this to different schools based on the funding that she's had. So she's able to provide this at no cost to the students or their families.
And Karen, I'm not sure if I understand the Arches program. Is there, what are the mental health supports that are offered? Is there counseling, or is this?
Yes. So
Okay.
Through the survey, if students decide to self-identify when they take the survey, they can then be contacted by Dr. Schuster or a member of her team to be approached about participating in the mental health program. It's a resiliency program. I believe it's upwards of 6 months long. And it's a program that would, and if the student agrees to participate and their families consent as well, it would allow them to be evaluated fully through a mental health evaluation. And then if they choose to participate in a, they don't call it treatment, they call it a resiliency program, but it's offering them services that would encompass counseling and other opportunities to really help them with what are flagged as potential high-risk mental health situations.
And how long would that last?
I believe, Carol, correct me if I'm wrong, I believe it was upwards of 6 months for that particular program.
Arches, I'm just looking at the info I have. I don't have it in 1 and 6 month marijuana abstinence challenge that provides incentives for youth to stop using marijuana and objectively evaluate the benefits on cognition and behavioral health outcomes. And the acronym ARCHES, and Karen and I both have myriad research and overviews. And I think it'd be great if we could share it with the board
I'd be
for
happy
whoever
to.
wants to look more into it. But ARCHES is adolescent research on cognition, health, and emotions in schools. And after the survey, like Karen said, they evaluate high-risk youth for serious mental illness. It's fascinating with the way their questions are formatted and how they can identify these youth. And then parent and child then works to address those issues. But the marijuana abstinence it says a 1 and a 6 month marijuana abstinence challenge. And then this year with COVID, well, last year, for youth that vape nicotine, virtual group therapy and pharmacotherapy intervention for adolescents who vape nicotine. And then virtual reality group intervention for adolescents at risk for mental health concerns. Traditionally, what Dr. Schuster told us is their team comes into the school and does this work, but the information she shared was more framed through COVID, but there is a lot of research supporting these two different programs. The I Decide is a curriculum, and then the ARCHES is comprehensive evaluation, identification, and two different resiliency or group therapy projects. So might be really valuable to have those PDFs that she sent. And then, as Karen said, she did a great job at Needham Public Schools, signed on faster. The other thing I will say, and of course this is Karen's thing, but what was valuable is that Dr. Schuster had 3 principals from schools that of many that have used the I Decide and the ARCHES program, I believe, in the past. So they were the ones, after the research and data and structure that were compelling, because the Needham team, and I had invited Dedham and Norwood, but the Needham team really asked a lot of questions, and having a therapeutic type of service in a school can be a bit overwhelming, but they all gave testimonial to the benefits and the outcomes. So I'll stop.
So it's an established program in the sense that these students, if they choose to do I Decide, for example, they're not signing consent like it's a research project, like informed consent, or their parents aren't.
No, I don't believe it's an established curriculum.
So they may collect data on it, but it's not like it's a brand new area of research where they would be expected to sign, expected to offer informed consent and have people sign it.
I don't want to misrepresent, so I should say I'd like to read that part of it, and I'm really committed not to misrepresent, but I believe, I can't say what I believe until I look at it. It was July 1st.
Okay.
As far as I Decide, and I, truthfully, yes, they collect data, and as far as participating as research, it might be, but I don't know if Karen and I can put our heads together and find exact answers to those questions.
Certainly.
I don't feel confident to reflect on that right now.
Okay,
But
no,
I can find out.
that's
And
great.
you raised
I
really
think
valuable
if it is
questions.
the research, the students, their parents are signing informed consent, that's just something we on the board should know about that.
And I will say, Dr. Schuster, I've worked with her in the past because I do a lot of referrals to ARMS at Mass General for youth up to I believe 25 for assessment, as well as the children's ASAP program. And with Dr. John Kelly, and I'll say, I know she would be thrilled if she had the opportunity to come on and share this work with you all if you're ever interested. I think Karen would agree, because she has such passion for it, and these schools have seen some really positive, I believe, quantifiable outcomes.
Okay. Well, we may choose to do that. But yeah, if you could get back to us on the whole question about whether it's pure research project. And Ed has his hand up.
Yeah, Carol, could you send me whatever information you have about this program?
Sure,
Oh, that'd be great.
absolutely.
The only other thought I had about it is that, for if this does involve some sort of, counseling therapy services for 6 months or so, then what happens to, and it's for free, then what happens to those kids who might be interested to continue receiving those types of services? I don't know if there's a plan in place for that, because currently with the town, we already have a bit of a waiting list for youth who are seeking counseling.
So I wrote those two things down, and Karen and I
did
can
too.
meet and we'll get these answers and the information.
Thank you.
Okay, great. Thank you.
Thank you all. It's good when you're all interested in asking tough questions, because that's, I know Karen and I feel the same. We want to try to give, well, with me, all our towns, the opportunity to scaffold these adolescents during a really tenuous time. And parents don't have the opportunity to drive and take advantage of programs in Boston. And we felt the way to do this and present it to the schools was to have these other principals, as well as Dr. Schuster, present.
Sure. I mean, they sound like very interesting programs, and it sounds like the schools are very interested. So
Mhm.
I think that's great. Thank you. And we'll look forward to talking about this more at the next meeting.
Happy to.
Thank you both. Other questions from the board for Karen or Carol?
I just wanted to say I've been on FMLA for family health issues, so I submitted my July report late, and I just wanted to say that we wrapped up our state 5-year funding for through BSAS, which is the federal substance abuse block grant money, and we wrapped that up at the end of June and did a line item amendment and spent that FY21 allocation down to $1.25. And then consequently, because we were awarded the Mass Call 3 grant, which is another substance abuse block grant fund through DPH and BSAS. This time we are collaborating with Walpole, Westwood, and Dedham. Norwood joined another group, and that is $125,000 a year for 2 years, with 3 2-year extensions up to. But we finalized the contract and Kate signed all the papers, so that started July 1st. And I'm grateful, and will be, the DPH hasn't released the guidance documents yet. So aside from just the logistics, so my timing actually is good. But that grant is starting again with prevention, underage, upstream, but with a particular focus on equity, inclusion, and diversity and planning during that first year. And I just thought I'd tell you that because Tim and Tiffany really supported this work, which allows me to keep going in Needham. So thank you.
Great, fantastic, thank you. Other questions before we move on? So I think we're up to public health nursing. And I don't think Tiffany is here.
Yeah, she's not back yet.
So let's see, we could probably just move on to, actually, Talib, part of this is yours.
Yep. Hi, everyone.
Hi.
Emergency preparedness report. One, we hosted the second MRC training, which is about saving life skills until EMS help arrives. For August, we are going to have our third MRC training. Will be about basic rules of radio communication. And we're still waiting to hear back from Needham Fire Department, EMS, to confirm the date and time. Last, we are reviewing and updating Needham plan about the emergency warming and cooling center. And yeah, this is for July.
Did the warming center need to be activated at the end of last week?
No, we haven't. But 2 weeks ago, I mean, the heat wave, the first one came, yeah.
Yeah. Okay. Thank you. Other questions from the board for Talib? All right, we'll come back to the rest of the public health nursing report, but for now, I think we can go on to the COVID-19 update. And I think that, I don't know, Tara, if you have something to say before Hannah.
Yeah, I think Hannah is ready to share. Are you ready, Hannah?
Yeah, I can give a quick update. Let me see if I can share the report. Okay, can everyone see this? Yes, okay. So this is largely the same set of slides from, I guess it was Thursday evening, so I'm not going to go through every single one again, but there are a few updated pieces. Just in terms of our case count, it's not updated on this graph yet, but since last week's meeting, we've had about 20 additional new cases. So we're up to 1,843 cumulative confirmed cases. Our rolling incidence rate is about the same. It's actually a bit lower right now. And we'll get an updated number from the state on Thursday. Incidence and percent positivity, I think this is the same as last week, just showing more of a full span of the pandemic in these graphs now. So you can see really relative to our peak back in late December, early January, that our rates really remain much, much lower. Cases by age, I think we talked about before, but one thing I drilled into on the last couple of days is looking at cases among children under 12. So on the right hand side, the bar graph is showing just splitting into cases under 12 versus 12 or older. You can see they've been pretty small count throughout, but then on the left hand side, this is showing the proportion of all cases, all confirmed cases among children under the age of 12. So it has been increasing over time, taking into consideration the cases over the last few days, the percentage is actually closer to about 33%. So about a third of the cases we're seeing right now are in children under 12 who are obviously unvaccinated. Breakthrough cases we talked about last week. This slide is unchanged. again, vaccine uptake. I think the other main thing I wanted to highlight that's different in this report is looking into hospitalizations a bit more. I know there is some interest in kind of digging into that. So as we've talked about before, hospitalizations are slightly trending up, but not nearly with the pace of cases. And there's kind of been this decoupling of cases and hospitalizations. I wanted to look at hospitalizations by age. The data on this is a bit limited. We don't really have hospitalization data for the town specifically, so I've been looking just at the statewide data. And so on the left again, this is just the 7-day average of hospitalizations. And I've just highlighted kind of the peaks and troughs throughout the pandemic. So the all-time low was in July, 81 hospitalizations, ticking slightly back up, but still, pretty much as low as we've seen it throughout. And the average age has kind of fluctuated throughout, but not by a lot. It has varied between 54 and 73. I think we're at about 65 right now. So it's not really, we're not seeing like a downwards trend where the average age of hospitalizations has gotten a lot younger, with the caveat that all hospitalization data by age is only up through the end of June. The state they were disaggregating it by age up until that point, and for the last 2 months, they haven't been putting that out anymore. So as of now, there's no way to really see any trends by age in terms of hospitalization. So unfortunately, that kind of times with right before we saw this uptick in cases. So it's hard to see how that's trickling down into whether we're seeing more hospitalizations among children right now. But up until that point, we do have this kind of disaggregated data. So this gives a pretty clear visualization. The red line is all hospitalizations in the state, and the blue line are hospitalizations among children and adolescents 0 to 19 years old. It's been a really tiny number throughout. It's almost at 0. And it's remained that way throughout. And this is.
Anna, do you have any updated data on that? Only because I see it only goes through June, of course, and we haven't seen that the uptick.
No, so yeah, that's kind of the issue right now is that this is data that I'm just getting from what the state is putting out publicly, and currently on the weekly reports they put out, the age disaggregation is just grayed out. So hopefully that is something they will start putting out again soon, fingers crossed.
Thank you.
And this is just looking, using the same numbers, but just proportionally, what percent of hospitalizations are among children. So at the highest we've seen was around 10%, and that includes all the way through teenagers. From about April to June, they were further disaggregating, so we could see 0 to 9 was, a smaller proportion of that, obviously. But yeah, it's remained, a very small proportion, and there, through the end of June, there wasn't much of a, you could say there's a slight upwards trend from mid-February through June, perhaps. But again, this access is only going up to 12%. It's a small proportion of our hospitalizations. But I can't really say exactly what it's looking like over the last month and a half. And this is just even more granular, looking at sub-age groups, just numbers of cases since during that kind of 2.5 month period where we were getting this disaggregated data. So you can see there's not really like one really predominant age group in May or June. Earlier it was definitely teenagers, older teenagers. But again, these numbers are very small, like a maximum of 12 hospitalizations for the whole state among this age group. Yes, and I think highlighted on one of the other slides is the fact that Needham itself has only had 2 hospitalizations recorded since May. They're both above the age of 60, so no pediatric hospitalizations as far as we know. And the remaining slide, I think, is the same one you all saw last week. Again, just looking at deaths, which remain at a pretty constant, very low level. Needham hasn't had any new deaths since mid-April, which is great. And yep, the last 2 slides we looked at on Thursday, just again, how the CDC is classifying areas of substantial transmission. I didn't check this today, but I believe Needham remains in the orange category. So I think that is it in terms of an update on my end. I don't know if there are any questions or slides we want to go back to. I'm happy to try and answer.
Does anybody know why they stopped giving updates on age distribution of cases? Probably not,
Yeah,
right? Maybe Tiffany.
Yeah, I don't think Tiffany has any more insight than I do right now. Unfortunately, there was one article about it by like NBC Boston, I guess. I think some journalists asked, obviously, the state. They kind of gave a non-response. Hopefully it's that maybe they are just kind of revising how they're putting out the age categories, especially because the way they were doing it before doesn't break it down at the like 11 to 12 cutoff for vaccination. So maybe they're just revising how it's done. I don't know, unfortunately.
Okay, thanks.
Okay, other questions for Hannah? All right, great. Thank you, Hannah.
Yeah.
Okay. Next items would be related to the Board of Health priorities. Tim and Tiffany are not yet back on the call. Tara, do you want to speak about this or?
Well, I got information in the packet about the funding request, but Kate Fitzpatrick is going to be coming up at 7, I believe.
At the select board meeting.
Right.
Yeah.
The other item I think we can touch upon while waiting for Tim and Tiffany is the signage. Remember we talked about on Thursday on getting the signage up in storefronts, how we wanted that signage to state strongly recommend or recommend. I don't know if the board had any other insight on what you thought about that and whether you wanted to spread it into municipal buildings with children. I know we touched upon that discussion on Thursday.
And I guess along those lines, do we want to make a formal recommendation? We talked about it. Is that something we should make a formal recommendation on? I'm asking other board members this question. Or should we just say we're going to promote signage and in general, we recommend indoor masking?
Did we receive language on that? Because I didn't see that in the packet, at least. Saw the funding request, of course.
No, sorry, Tim is still stuck. I shouldn't say stuck, still presenting on the the select board meeting, so he asked me to jump off. But no, we haven't been able to get to that yet. One thing I would like to suggest too is DESE came out with some guidance on Friday that is very concerning, a little bit backwards at times. And so Susanna, the school director, health director, Tim and I had a meeting today, and we'll continue to have a meeting tomorrow about what portions are appropriate and what portions are not appropriate within that. But looking through all of that, they have different options. They have test and stay. They have, which is where even if you're exposed and you're considered a close contact, then you have to test that you can stay if you're exposed, if you're a close contact within 3 feet, as long as you have no symptoms. Or if you develop symptoms, you can leave. If your test is negative and your symptoms subside, you can come back and continue to test and stay even within those 14 days, which is completely different than what the state recommendations for quarantine policy is. So those are some of the concerning things. And it's a lot more nuanced than that. No close contacts on buses. If you're masked, no close contacts with 3 feet. If you're not masked, it is. So hammering that out is going to be very interesting based off of the data and the information we've received.
Tiffany, are they making a distinction between the age groups that can be vaccinated and the age groups that cannot?
No. No. So it's through all. They are only making a distinction in who can get tested, which testing protocols you can use. So some can only be used from K through 6, and others can be used for all. Which ones are which, I don't remember off the top of my head, but yeah.
And are we still sticking with 14-day quarantine for close contacts versus the 10 that the state?
No, so that we,
Okay.
even last year, we did the quarantine, test at day 5, you can return at day 8 if you have no symptoms. It's
Okay.
only if they develop symptoms in those days, did they have to remain out for 14 days. And that's still the state requirement, but not the DESE. So there's a few nuances in there, but.
And that's for unvaccinated, right? So
correct.
Yeah, kids that are vaccinated who have close contact would not necessarily need to quarantine if they don't have symptoms.
Correct. They can still continue to go to school, but if they develop symptoms, according to the state, according to DPH, if they develop symptoms, even if they're vaccinated, they have to remain out for the rest of those 14 days, even if they test negative. So, yeah.
It's going to be a problem with all the viruses that are going to go around the fall.
Right.
Yeah, and that's another thing too, is they put up the change in which symptoms you can have as a main symptom and which symptoms have to be combined with other symptoms. And they
Okay.
put sore throat as one of those combined with other symptoms before you don't come to class, which is also another concerning piece. So, yeah, really looking at those.
So is the school system actually bound to those or not?
No, we can make our own recommendation onto what to do and which ones we will accept and whether or not what we'll do. And to be honest, I don't think we're going to do all of what DESE has presented because it's just not smart and they're not giving us the data to back it up. No matter how many times we've said, where's this study you said that was done in Utah, we'd like to see it, please give us, and they're just not producing it for us. So
yeah, I know
so
there were
we want to-
disagreements behind the scene last year between DPH and DESE, so
yeah.
not surprised.
No, Utah
We-
studies was in MMWR. That's,
Has it been? Okay.
yeah. I can send it to you if you want.
Yeah, that'd be great.
So.
And I just say one thing that
Carol
was
and then
very,
Diana.
what?
Go ahead.
One thing, and I listened and then processed with Tiffany because of my Board of Health role in Medfield and also trying to help Tiffany out with case guidance when I did last winter. Russell Johnston presented. He's the Assistant Commissioner of DESE, and he was very emphatic that this was a collaborative project with DPH. And that one of the questions in the chat was, how did you get this information and create these standards? And he said, we've been working on this, and where did it come from? DPH and DESC is in lockstep, and we used the best science, medical knowledge, and our knowledge of how schools operate. And we understand that we are working on an additional FAQ document, and you have lots of questions, but this is how it's basically been created and going to be. So I felt, my impression was, they're really confident. It'll be interesting to see, because there were many, many questions about the disconnect between what we're doing in local town, but then how you can circumvent the quarantine rules by getting tested every day as a student and staff for 7 days and staying in school. And I know there are some of my communities, they're, our nurses willing to do the test and stay, and then the buy next now. And I don't know, how many districts are actually going to take advantage of the testing program. So there's a lot of disconnect, in addition to it conflicting with standard DPH guidance. I don't know if I captured that, Tiffany.
Yeah, so basically the question is if a kiddo gets exposed at the Y, they have to follow regular guidance. But if a kiddo gets exposed at school, then they have to do a different guidance. And why don't those connect, and why aren't they the same? So.
Thank you.
Diana, you had a question?
Yeah, my question, I didn't get to go over the DESI stuff, but are they going to be required to social distance? Because we were working on the recycling food waste stuff with Colin. We just didn't know, or I didn't know if they were going to be doing social distancing at all.
No, all other requirements are done with. It's just the determination of masking that they will figure out, and then what we do with contact tracing and stuff like that.
Do we know there's no remote option at all for kids who are home? It's worse this year.
Correct, and it counts as a sick day, which actually goes against the school dates and stuff like that for federal funding and things like that. That's what Susanna.
Because they have to be there like X amount of days or something.
Right. That's, I mean, a remote option for kids in quarantine seems like would be a very good thing. Or working on condensing the quarantine and doing the test and stay. I mean,
yeah.
Have we ever analyzed our cases from last year in the schools, and how many close contacts from school became a case?
Analyze as far as, do we know? I think on my best guess off the top of my head would be probably 2, maybe 3.
Right.
Mary would know.
Test and stay might make sense, right? I mean, if it can be managed, still the state will pay for it. Sounds like.
My only concern with the test and stay, and one of the things we're discussing is in elementary school right now, they are going back to small group reading. So everybody goes from their chair to a carpet and sits and reads and goes back. So if they're not keeping very good track of who, where, how, and when, and how close they are together, that whole classroom could be out. So if we do test and stay, or even if we do pool testing, that takes more kids out if we find a asymptomatic person than keeping them in school. And we're back to the same concern, is the kiddos aren't in school, it's counted as an absence instead of remote learning. So lots of moving parts that have to really be analyzed and looked at.
And a lot of this, with the DC and the DPH thing came out like right the day after the Health and Safety Committee met.
Yep.
And made recommendations that Dr. Gudikantz was going to take to the school committee. And then he sent it out to the community. And then DC, like the same day, sent out something completely different. So I'm sure we'll be talking about it on Thursday at Health and Safety.
Yeah,
but it's really,
Friday evening.
it's very confusing. And
One thing I will say, I wasn't able to, I'm not in the schools, so I wasn't on this morning Russell Johnston presentation. But they said there will be a recording of this whole structure and all his answers and available, Tiffany, correct me, I believe, through Maven. So I know that.
I was on the Maven one, which unfortunately they do at the same time. So I don't know about the school one,
but they said because there's usually hundreds of people on this call, and they said you can access his same thing if you or your community want to listen to it. So I know I have people that would like to listen to it. Maybe we can forward along the link when it's available, if any of you want to review and listen.
okay. Do we want to finish up the discussion about the signage? And we're going to strongly recommend, and I guess where the signs could go, specifically municipal buildings, because I'm not sure we came to a final determination on that at our last meeting.
Sure, and I did just get back, so I apologize if anything's been discussed before. We don't have a response fully from the business community, aside from saying some of them are interested in signage and some of them said they weren't interested. So we need to narrow that down a little bit better. We certainly have the option to post in municipal buildings or in other sort of public town settings that masks are recommended, especially if your loved one is in a high-risk group. So I don't think that's particularly controversial. At least in mine, in terms of bulletin boards, signage, maybe the RTS message board, sort of thing.
When I went to Starbucks today to do the inspection, they had one that was just a picture of a mask and said strongly recommended, and it seemed okay, not too strong on anything because there was a mix of people in there. So just as an example.
What about in municipal buildings where kids are normally expected to be present? Should we require them?
So the Park and Rec department is going to, they talked to us and are going to basically mirror schools so that masks are going to be required for all of their programs. They're going to limit capacity in some instances, not to necessarily 50%, but in a large room like the multi-purpose room at Rosemary, where they might usually have 50 or 75, they're going to keep it to 30 to 35. And they are going to sort of mirror the work that the schools have. So it wouldn't be different if you are in an elementary school and then a Park and Rec after school arts program.
What about the library?
I have not gotten in touch with the library yet, so I'm not positive on that one.
Okay.
I do have to find that out though.
What about the senior center?
Oh, Ed, you're always throwing me a tough one. I don't know. The senior center is uniquely challenging in that, seniors are eligible for vaccination, all of them, of course, but are in a high risk group, many of them. The senior center also certainly has very strong opinions on both sides about whether masks are necessary. I certainly think we could do masks are strongly recommended. The question would be whether we want to go any further than that. It's a challenging one, and I really need to actually have a discussion with you and the Council on Aging board about what they think is appropriate. I know that staff have been loath to have to be the sort of cops enforcing it because there are some seniors who are deliberately provocative or want to have a debate about it. And there's many who are certainly compliant and will happily participate in whatever is required, but the staff has some concerns about having to be the ones that sort of blow a whistle on someone for not having things on. But yes,
as part of the signage, especially for the senior center, we could strongly recommend that they be used, but we could also in another sign strongly recommend that people who may be immunocompromised or have significant chronic health conditions not go in.
I think there's a certain amount of self-selection going on already there.
Yeah.
Among the seniors, but something like that may not be a bad idea. So I would opt for, at minimum, that masks are recommended, strongly recommended.
We're also trying to get people to they exercise there, right? So that could be a real challenge.
We are, although I was there this morning and there were, Ed, that they can have maybe 10 or 12 people and there was 5 in there. So it wasn't packed to capacity, although I was glad to see people exercising because there's a lot of seniors who reached out to say that they relied on that for fitness and they didn't have that option during the previous part of the pandemic.
I mean, I agree with that. I think it probably could handle maybe 1 or 2 more than 5 with still distancing. I admit for many seniors, it might be very difficult to exercise and wear a mask at the same time.
Yep.
But I don't know. Maybe I don't have a good answer. I'm sorry.
I've seen seniors exercising in masks. It can be done. I don't think anybody's the most comfortable. I mean, I was exercising in a mask for quite some time.
Yeah, I've done it.
Yeah. So I don't think that's too burdensome, to be honest with you.
So where do we want to go then with this the masking thing? We want to just strongly recommend in municipal buildings and leave the businesses to themselves, or?
Yeah, recommend, I think. Yeah, it's fine. If you want to put the immune compromised, something on there is fine. Although you're telling people not to go in, I guess. Is that what you're suggesting?
No, I kind of meant that for the senior center. I was thinking in other places, we would either recommend or strongly recommend that in indoor spaces, that face coverings be used.
I agree with that.
I agree as well. I think that should be throughout the town. I think it's just a matter of whether or not we have more restrictions in areas where we have immunocompromised and kids in municipal settings, government settings.
Well, Tim, you had said that in municipal buildings, it'll be like the schools, right? If kids are present, then.
Yes, I mean, I guess, if someone is accompanying their parent to town hall to pay a bill, I don't know that we will necessarily catch people like that, but I think the suggestion would be that any person coming into town hall is unvaccinated needs to wear a mask, and that could be someone who's 60 and choosing to be unvaccinated, and someone who's 10 and doesn't have a choice.
It's a very short-term exposure too, right? You're walking.
It is.
For a few minutes.
So I don't know if that's something we should sort of focus too much time and attention on, because I don't know how many kids are coming into town hall on a regular basis.
Right, or even if they were, it'd probably be less than 15 minutes. So it would.
I doubt that it's very many. It
wouldn't even be long enough to qualify as an exposure if they're in there for 10 minutes. But the library might be different.
Right, and if they're going to begin all these story times and things like that, again, they're so well attended, and often people are coming with, with parents or other caregivers.
I think for the kids where there's many, for the thing at the library, if there's going to be a lot of, the expectation is that many of the attendees are unvaccinated children, right? So that makes sense for events, for programming, strongly encourage, sign on the door, kind of what you're thinking.
Yeah, I think a sign on the door, it says strongly encouraged to wear a mask in this building would be reasonable.
And I would even add to that, in buildings where children are going, we could strongly recommend, in large part to protect children. That's, to give people a really good reason to put a mask on.
Yeah, I like that idea.
Yeah, do you want to have like, you could even do like two signs, right? I mean, you could have the general sign that's, mask wearing strongly encouraged or strongly recommended or what have you. And then another one, like we do for, children on board in cars, you see those things, right? So, children present, please mask up or something like that. And that could be done, separately. You could even do it in like a kid-friendly font so it'll, get some attention beyond the usual signage.
No Comic Sans. Okay, but yeah.
Get the idea. Yes.
Okay. All right, other thoughts on that topic?
Do we need to vote on this?
That's a good question.
I think it's up to the board. I mean, since it's not a mandate, it's a strongly encouraged, then, the board can strongly encourage anything it wants, and the Public Health Division can develop the materials to do that. I think the board would only need to really vote if we're using the board's statutory powers to make a requirement that's in place.
That sounds reasonable.
Yeah, same.
Okay, and the signs will say something about the Needham Board of Health supporting these recommendations. Okay, so it doesn't sound like we need to vote. Okay, before I thought maybe since Tiffany is now back, we probably have a minute or two to go over the public health nursing, which was earlier on the agenda, unless anybody has anything else they want to discuss about signage and recommendations. Okay, Tiffany.
Right, let me pull it up. We'll get to it. All right. So Mary is off today. She'll be back. So excuse me if I don't know all the information about what I'm about to present, but for the most part, we held an MRC training last month in July. And we did what to do until EMS arrives. Eddie from Needham Fire came and he did excellent. It was a great presentation. We invited multiple MRC groups throughout NC8, and we had about 22-ish show up, which was awesome. One of our better presentations, better attended presentations, which was great. Wrapped up our camp inspections last week, I believe was our last inspection. A couple camps will continue through the rest of this month, but not too far. We're pretty much almost done with that. I am happy to say we haven't had any cases that I am aware of in camps, in any of the Needham camps, so that's also great. We did have one concerning camp issue with St. Sebastian's where they told us they were going to hold it at a certain time, and we were working with them to get their policies up to snuff, and then all of a sudden they decided to have it without telling us, and then we get back trying to figure out if this camp is going to open, and they're like, oh, we actually held it 3 weeks ago. So we do have to have a little bit concerns about that as far as doing some more education on, you can't just hold a camp because you don't necessarily like the policies that we're telling you need to have into place. So more to work on that. Talib is helping me work through our EDS warming and cooling to get them updated appropriately. We did semi-open a cooling center or at least had a hotline number people could call. They could call the one public health nurses if they had a concern. We had a couple of residents reach out through the senior center about that, but nobody called us looking for specifics or what to do. So as far as our communicable diseases, we had 3 babesiosis, which is pretty normal for this time of year for us. Looking into that, and then 7 Lyme, again, it kind of tracks the same. I'm not seeing any major change comparative to the last couple of years. And then our cases of COVID, and I believe Hannah went through that. I think you guys already did that, right?
I saw there was one case of Borrelia miyamotoi.
Yeah, which is,
I was wondering, do we have any last year?
I don't think we had any last year. I do think we had one the year before. I'll have to double check. But I don't, yeah, it's not on for last year, fiscal year 21. So yeah, but do think we had one the year before. Maybe it's been 2 years, maybe fiscal year 19. But I don't have any background data on that one. So if there's something we want to know, I can check with Mary for next month.
They're just rare. I was just wondering if they were growing.
We see them every once in a while.
Right.
Luckily, we haven't had any alerts, and we're still in the low for EEE, which is great. We also hadn't had any alerts for West Nile virus, which is also another positive. So hopefully those stay. This is the month we usually see a bit of an increase, so hopefully not. We did have one bat bite, and we have seen a couple of concerning, and I don't know if it was this month. I know one was in June, but concerning with woodchucks. So just beware of rabid woodchucks hanging around in Needham. I think one was a bite to a resident, but that was June, but one was a bite to an animal, and that was last month.
There's your headline if any members of the media are listening.
We don't put bites to animals on there, just bites to humans, but that did happen. So yeah, see, Tully helped us with that. I also don't know if who spoke about that, but we are working on our vaccine clinics for flu vaccination coming up. So we are picking the dates and working through that process, and we'll get going with that this year. Yeah.
And maybe boosters will be coming back. Well, they may be coming. Expected to be announced tomorrow or Thursday, but yeah, maybe we might be doing that. I don't know if the state will do it differently if it's a booster.
Yeah.
Through the towns.
How do you manage that with 10 doses in a vial? Like still, right? Is that you're wasting 9 to get
so
compromised?
Yeah, if we're doing the booster versus the 3rd shot, definitely if it's a 3rd shot, you're going to waste several doses, right? Because it's make an appointment, come, we're going to do this. If it's the boosters in general for the general population, that will be more like what we did previously, but eventually, because in this last couple months, we definitely wasted several doses because I'd have one person come and it's going to expire. So I might as well give the one versus not give any. So, so yeah, definitely need to figure out a smaller dosage amount in those vials.
Questions for Tiffany? All right, great. Thank you, Tiffany. So that brings us back to Board of Health priorities, Recovery Act Select Board priorities.
Sure, and I think we can talk a little bit about this, and I can also mention another good piece of good news. So I included in the Board of Health packet a fact sheet from the Select Board meeting that is going on concurrently. I have it on my laptop, and they have not yet gotten to this item on the agenda, but as the board can see from the fact sheet, the town manager is going to present to the Select Board a recommendation on how to spend some of the ARPA money on immediate public health priorities. As I mentioned on Thursday last week, that the Select Board intends to engage the community and other elected bodies and the public in general on discussion of how ARPA funds should be used. They did exempt some funding specifically for immediate health needs, and this is what that sort of falls into. I anticipate a positive vote, so that will provide some additional resources, which will be great. We did also find out late last week that we got 2 different regional grants. We got we believe the full amount of funding for a regional case investigation and contact tracing grant that would be shared across Needham, Dover, and Medfield, with Needham as the lead. We did get funding, not as much as we had hoped for, but funding to share some environmental health services as well, again with Dover and Medfield, with Needham as the lead. We have not yet reached out to Dover and Medfield informally because the state posted the award notice, but has yet to send us the actual award letter saying, congratulations, you've got this much money coming, sign the contract. So we want to wait till we receive that before we officially reach out. But that means that there is some ARPA money that is going to help reinforce the Public Health Division's response to COVID for the coming year. And there's going to be a fairly large influx of funds to help us work regionally with 2 other communities who have fairly limited health departments in terms of professional staff. They have certainly smart and committed boards, but most of their services are provided via contract and they don't necessarily have much in the way of full-time staff. So that's a good opportunity to work collaboratively with our neighbors. And I think I'm interested to see where that goes, whether we can help sort of support and develop and mentor them so that they can be more functional on their own, or whether it makes sense to try to pursue some type of regional collaborative that is more permanent and isn't just project-based. I think, a lot will depend on what this board is interested in. A lot will depend on what the boards in those 2 communities are interested in, as well as the sort of town government, town manager sort of folks in terms of what they think would make sense. I know that Ed and I have talked about this in the past, and Ed, you've specifically encouraged in your role on the Mass Association of Health Boards board. You've worked with other boards, including some folks from Dover and Medfield in the past.
Right.
So I think, it's an opportunity for both communities to sort of figure out what they want. The Special Commission on Local and Regional Health produced a very detailed report that outlined the sort of capabilities that it expected local public health to be able to achieve. Ed's nodding because he was on the commission, so I don't really have to tell him what's in it. But also workforce training requirements, professional development requirements, and highlighted the fact that the state provides significant funding for a lot of local entities, including police and fire departments, Department of Public Works, certainly public schools, to assure sort of a minimum level of service. And it does not do so in public health, so that there are wide discrepancies in the public health services provided in different communities. I'm certainly interested in figuring out, like I said, what makes sense. What would Dover and Medfield like? What would help them? What would Needham like? I think, we have a vested interest in having strong public health partners. So even if there isn't an interest in sort of a combined department, we want to make sure that our neighbors, we can help our neighbors when they're in need, and they are sufficient enough to help us when we're in need. We want to have good mutual aid partners and know that we can rely on that at the very minimum, I think. So those were the sort of the main points I wanted to hit. That ARPA funding is subject to a select board vote, but we anticipate that will be positive, and we're hoping. I have a meeting with the HR director on Thursday to talk about how we have all this new money and we want to hire a bunch of folks. I know that there were other sort of priorities from the Board of Health in terms of non-immediate public health uses of funding, as well as general priorities that Rob and Christina had put together to provide with the select board. And a lot of them had to do with mental health access. Christina, did you want to talk a little bit about those priorities?
Sure. I'm just looking at what you wrote up and seeing if I think it's pretty similar to what we were talking about. I think, the main issue that we've seen this past year that Sarah Shine has shared with us is that there's been, a greater number and greater acuity of mental health issues amongst our adolescents, and that these cases have been trending kind of younger even. She said a good majority of the kids she's seeing these days are middle schoolers. And so, part of our effort, our initial meeting last month, and the letter that we wrote was one, just to bring light to this issue and share it with the community and with the select board, and request some additional supports, whatever, they might be. And it looks like, asking for some additional funds for staff. And so I see that in your request that you did ask for a full-time clinician. And so is that's something that they're not taking that up at this meeting?
They're not. I do think it is an issue, and it's not. There's going to be some turnover in the Youth and Family Services Division, which is unfortunate because we're losing 2 longtime staff members, but does also provide an opportunity for Sarah to bring in sort of a new team, sort of cohesively together. I think the challenge sort of is that right now we're seeing a sort of very serious need for mental health services, both from school-aged youth and their families. The schools themselves are working to try to address those needs, but Youth and Family Services is often a significant part of how the schools respond to mental health crises. So my hope is that is something that would be acted upon maybe sooner rather than later. We know that Recovery Act funds aren't permanent, but I think the hope is that this is sort of a hill that we need the resources to summit, or a mountain that we need the resources to summit, and then maybe we can go back to a more sustainable level of service once some of the sort of post-pandemic mental health impacts have diminished slightly. So my hope is that the select board would take that up maybe post Labor Day, but with an idea that it would need to be acted upon this fall, hopefully early this fall. But I think it's certainly within the Board of Health's purview to sort of push on that, and also the Youth Commission, if they're interested in pushing on that.
So Tim, under your memorandum that you sent to Katie King, those funds are still ARPA funds, but they would be allocated to the health department from the select board?
So, and this has been an issue that's sort of been covered in some cases in different parts, like the legislature has taken specific actions to, maybe restrict how Governor Baker can decide how much is spent. But the town meeting is the body that appropriates most funding in town, the operating budget funding, capital budget funding. However, the sort of town administration and or select board receives grants and donations. So they have the discretion to distribute them. As I said, they want to have a sort of deliberative and engaging process to understand what the community's wants and needs are. But they did, cut out sort of a subset saying, when there's a particularly acute health need, we understand that we may have to act more quickly on that than a sort of a large months-long information gathering process. So that's what they're taking right now for the immediate public health need. And then I think the hope is that they might respond to some of the more mental health, social well-being needs as well, hopefully in an expedited manner.
I was happy to see too that they are voting on the EPI position as well.
Yes, I was happy to see that too, and a full-time EPI position, not a part-time, which I think is great. We are, obviously, I mentioned it before, we're very sad that we're going to lose Hannah Whitehead, but we hope that we can, she's sort of established, I think, a really great foundation on how we can collect, analyze, and then publish and present in a visually attractive way information to the public. So we will have those resources for at least another year, which would be great. It's my sort of long-term goal to try to have that become part of the Health and Human Service Department or the Public Health Division's budget. But we've got it for at least another year, which is great.
Well, I like the memorandum, and I think that the resources that were requested were appropriate to the things that we talked about as a board, and Christina and I had also discussed with the select board. So hopefully that'll result in some more resources.
Yep.
Okay. Other questions or thoughts about this? All right. Upcoming board meeting topics, I guess they're listed there on the revised agenda. I don't know, is there anything that we need to discuss now related to those?
I think the one thing is just that we have a lot of topics that are sort of queued up either because of vacations or because of work that has, project-based work that is nearing a conclusion. So there's probably a lot more than we can handle at the September meeting there. My understanding is that the board has high interest in hearing about mental health in Needham, specifically from Sarah Shine, the Director of Youth and Family Services, and that we should try to work in water or pesticides and fertilizers into either September or October, but that we really want to make sure we get mental health in September. So if there's other things the board wants to see, please let me know, but that'll be sort of how I approach trying to fit those in with our normal business.
I think that sounds good. And maybe we can also have Carol and Karen talk about this Arches program and kind of, continuity of care for youth who access that, once that's finished after the 6 months, that it will be offered.
I think that's a good idea.
Okay. Great.
Okay. Hannah, is this your last meeting?
Guess so.
Well, on behalf of the board, I want to thank you for all of the hard work that you've done to keep us all really well informed,
Thank you.
keeping the health department informed, keeping the community informed, and especially for us so that we can make sensible decisions for the community with really good scientific data. And we thank you for that.
Thank you. Yeah, it's
Thank
been
you,
really interesting to work with you all. And I'll be keeping tabs from afar, and hopefully those numbers will not be going up too much.
Hopefully not.
And just to warn you all, September's may not look like that if I'm doing it. So I'll try my best, but she's high standards to live up to.
Tough shoes to fill.
Yes, absolutely.
Okay. I guess we're up to a motion to adjourn.
So moved.
Second.
I'll second.
Okay, and a vote. Steve,
Yes.
Kathleen,
Yes.
Christina,
Yes.
Ed,
Yes.
and Rob is yes. All right. Thank you all.
Thank you.
Appreciate the
Thanks,
time. Thank you, Hannah. Good luck in your future endeavors.
Yeah. Good luck. See
Thank
you.
you.
Bye, Hannah.
Bye,
Bye,
everyone.
Hannah.